As COVID-19 variants drive the third wave across the country, Ontario's ICU capacity is hitting a critical point. Right now, there are 410 ICU patients, with 46 admitted in a one-day record. At the height of the second wave, there are 420 ICU patients. And on Tuesday, Ontario reported 1,210 cases that screened positive for a COVID variant. That's the highest in one day. This could mean a new protocol at Ontario hospitals, where doctors will use a calculation tool to compare survival rates among patients if there are limited beds. Joining us now for more is emergency physician Dr. Lisa Salamon. Doctor, thank you for taking time out to discuss this with us. We really appreciate your time. Three provinces, Quebec, BC, and Ontario, are battling the third wave. Hospitals are on the brink of being overwhelmed. Canada's top doctor, Theresa Tam, said this on Tuesday.
Over the past week, an average of over 2,200 people with COVID-19 were being treated in our hospitals each day, representing a 6% increase over last week.
So, Doctor, infectious disease specialist Dr. Abdu Sharkawi says this will be the worst wave yet. What do you think, based on what you're seeing at your hospital?
Yeah, I have to say I agree. This wave has sort of come very quickly, much quicker than the previous two waves. And, I worked on Monday, and at my shift, it felt exactly like it did at the peak of wave two. And the difference is, at the peak of wave two, we were shut down, and we knew, or we were hoping, that a plateau would be coming soon, which it did. This time, things are actually opening up, right? There are gyms opening outside, patios are open. We have a holiday weekend coming up in a couple of days, and there hasn't been really much discussion about an emergency break. Schools are open this time, so it's quite frightening given where our numbers are at, and given how fast we've seen this exponential rise in cases, hospital admissions, and ICU admissions.
Well, in Ontario, the new protocol doctors could use soon, it includes a short-term mortality risk calculation tool. It's a lot of words, but what health factors does it look at when determining a patient's survival rate?
Yeah, I mean, it actually looks at really what first of all, there's a long way we have to go before that. I mean, we do have beds still, but also the important thing to know is that we need to have really good goals of care conversations with the patients when they come in. And a lot of these patients choose not to go on a ventilator for various reasons if it were to come to that. We have these discussions. This has been going on for a long time. But really, the first thing, if we ever had to get to it, would be to look at people who have an 80% mortality. So they have their risk of dying is 80% or more, and that isn't necessarily based on any specific premorbid condition. It doesn't have to do with age. It doesn't have to do with disability. It's actually what's right in front of you. And an example of that would be, for example, if someone has a severe trauma, we look at trauma scores, and a really high trauma score where their risk of dying is more than 80% would be someone that, when we talk about this risk tool calculator, for example.
Doctor, do you have any issues with this new protocol? How do you feel about deciding who lives and who dies using a formula?
Oh, I don't. Well, it's not the formula, so I don't think I have a concern about this. Formula is not. It's not a formula. When I looked briefly at this tool, it's actually very specific. It's not a formula. I do have, it is uncomfortable choosing, making these determinations, but particularly in the ones who have over 80% mortality, we do this on a regular basis. We actually have these conversations with patients when someone comes in without, what we call vital signs absent, where their heart's not beating and we're running a code. We make those decisions. If we don't get a heart rate back within a certain period of time, we make the decision to end our resuscitation. So this isn't necessarily that different from what we already do. When we see someone who is really sick and has a low risk of survival, now we have those discussions with either the patient if they're able or with their families. So I think that people are very uncomfortable in the public hearing that there's this quote unquote tool or a score sheet, but it actually is very specific. It's not only one physician that's going to be making these decisions. It's two physicians making these decisions, one being an ICU doctor, and in addition, a lot of the hospitals are going to have committees. The other thing that's important to note that right now in the discussions, or in what I've learned, is that if this is an emergency patient and we don't have time to do this tool, we don't. We do our regular care that we normally do, and everything is, as we usually do right now.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.